An emergency committee on the novel coronavirus will be reconvened by the World Health Organization Director General Dr. Tedros Adhanom Ghebreyesus said the committee will advise the Director General on whether the outbreak constitutes a public health emergency of international concern and what recommendations will be made to manage it. But we're told that the death toll from the coronavirus outbreak has risen to 170. Here is a report on the story so far.
On the 31st December 2019, the WHO was alerted to several cases of pneumonia in Wuhan city in China. The virus did not match any other known virus. On the 7th of January 2020, Chinese authorities confirmed that they had identified a new virus called coronavirus. And between that time and now, the disease has claimed 170 lives, and the number of those infected continue to rise. Today, the Chinese media is reporting the disease has spread to every region in mainland China, from Wuhan, where it first broke out.
Closed relevant markets in a speedy manner, tighten control over illegal breeding, transportation, trading, and consumption of wildlife or wild animals. We have closed on a temporary basis airports, train stations, and other exit channels from Wuhan to prevent the spread of the virus. We have also coordinated the mobilization of Central Medical Reserve to distribute relevant materials to Wuhan. We have transported protection suits, masks, gloves, goggles, and other materials to Wuhan. The
infections have also spread to at least 15 other countries, including Japan, US, Vietnam, Finland, and Germany. DW's Emmanuel Shays confirmed the patients and a few others have been quarantined.
Since yesterday, 4 more cases have been confirmed by the Bavarian authorities, by the German health authorities, and all are linked to this initial case you mentioned. And Germany is so far the only country outside of Asia where the virus spread directly person to person.
There were fears this could spread to Africa, where a suspected case was recorded in Ivory Coast. It later turned out to be negative. However, just 2 days ago, a student who arrived in Kenya was quarantined in Nairobi after exhibiting coronavirus-like symptoms.
Examination, the suspected case was found to be in stable condition with all vital signs within normal ranges.
Back here in Ghana, the Ridge Hospital and Tema General Hospital and other holding centers in other regions have been equipped for possible cases. Health officials insist they are prepared to deal with any such case.
Measures we put in place, we are hoping that it will actually help us detect a case entering the country.
Meanwhile, the WHO is meeting to consider whether the virus constitutes a global health emergency.
We'll bring you details of how many people have been infected and how many people have died since this started on the 20th of January. But let's quickly go over to the phone and talk to Professor Theophilus Adiku. He's a virologist at the University of Ghana. Hello, Prof.
Hello.
Prof. Adiku, thank you very much for your time this afternoon.
Thank you.
The government has told us that the Noguchi Memorial Institute has been dedicated, to checking and doing research about this coronavirus. But at this point, have people like yourself and people working on this any idea what exactly we're dealing with now?
Yes. Since the outbreak occurred in China, actually people have died, and there are about 12,000 suspected cases. So this has created an emergency situation whereby everybody has to be very vigilant to prevent the spread of the virus worldwide, especially to our region in West Africa, where we know that we have the conducive right and sustain the virus in the environment for some time. And so we have to be very vigilant so that cannot spread very quickly and cause any mortality.
I'm sure that you have seen some of these things. I mean, I'm sure you've seen Ebola, which we all know. You've seen other epidemics as well. But what does the trend tell you? We're told that initially they weren't sure that this could pass on from human to human. We were told it was from animal to human. But right now we know that it is spreading from human to human. Yesterday, I had a conversation with our partners in Germany. They tell us that if you have had to look at somebody who has the virus, close range for about, a couple of minutes, you could get it. I mean, what does the trend tell you from what you know already? I think I'm losing you. I lose you intermittently. Can you please reposition, and if you could start that again?
Okay. I'm saying that if viruses emerge, especially when they come from animal sources, it takes a while for them to become adapted to the human body, and then human-to-human transmission then starts. So this virus has gone through that process already, and there's a human-to-human transmission.
Okay.
The unfortunate thing is that because it is a new virus, the human immune system does not have antibodies to protect against it. And that is why a lot of people become susceptible, and the virus can spread very quickly. And coronaviruses are respiratory viruses, and these viruses are spread through nasal secretions, saliva, and all those secretions that come from the respiratory tract. And this can be spread very quickly when we cough or sneeze. And that actually helps in the spread in the population. So that is how serious it is. We have in mind, we biologists, we always refer to an outbreak which occurred in 1980, influenza virus, which occurred because of the Spanish flu. It killed about 15 million people worldwide. And that has always been at the back of our minds when we are talking about respiratory diseases which spread so quickly and affect the human population. So that is how serious this disease gets out of hand. So we have to be very vigilant and make sure that we contain it as quickly as possible.
In less than a month, this disease or this viral disease has been able to spread across continents and across countries. We've seen between that short period about we're hearing about 7,000 infections. Would you compare this to Ebola, looking at the rate of spread?
This is actually a pandemic because once it cuts across continents, then we are now looking at a pandemic situation. With Ebola, the transmission pattern is different. For respiratory diseases, we have air droplets. We have droplets which are spread from those who have infection, and they are carried as aerosols. And there are nasal secretions which can contaminate the hands, so you have handshaking. So when people come in contact or they are in close contact, you can easily spread the infection. So it can spread faster than Ebola. So we are talking about two different situations. This one is third one. Ebola is by individual contact.
Close contact with individual. Doc, thank you so much. We'll speak to you later on as well on radio for more details on this. Dr. Professor Theophilus Adikude, he's a biologist from the University of Ghana. As you heard, this is a very different kind of virus, different from Ebola that spread from close contact. This one is airborne. Well, what do you need to know? Here are some details we've put together for you.
What you need to know about the coronavirus outbreak in China. The WHO calls it novel coronavirus, or 2019 nCoV. It is a family of viruses consisting of SARS, MERS, and Ebola. It spreads very quickly and can be very deadly too. It is spread from animals to humans and can also spread between humans. Symptoms include fever, persistent cough, impaired breathing, running nose, skin rash, persistent vomiting, and unexplained bleeding. Is there a vaccine? Well, this is a new outbreak
So there had not been any vaccine until January 27th, when Chinese scientists announced a new vaccine which is said to be doing very well. Other scientists around the world are also working around the clock to develop a vaccine. The Ghana Health Service and the WHO both advise people to frequently wash their hands with alcohol-based hand rub, or what we call a sanitizer, or warm water and soap. Cover your mouth and nose with a flexed elbow or tissue when sneezing or coughing. Avoid close contact with anyone who has a fever or cough. And if you touched a surface suspected to have been infected, do not touch your eyes, nose and mouth before you wash your hands. Avoid eating raw or uncooked animal products, and seek medical help immediately if you discover any of the symptoms, and share your travel history with healthcare providers. If you do this, we will all be safe.
That gives you an idea what to do. Certainly we'll bring you more of this now. Just between 24 yesterday when we came on this show and now, 64 people have died.